and also make sure we're on live. I'm gonna check my phone. If you are on, if you guys wouldn't mind just waving hi so we can tell that people have jumped on before we get started. Let's see. I love this technology. All right, I think we are on. So, okay, join live, only visible to you. Okay, well, hello everybody. It's Pam Frasco with Project Preemie, and I'm joined by the wonderful Dr. Jessica Madden, who we are fortunate enough to have on our Project Preemie Advisory Board. And she is a local neonatologist at University Rainbow Babies and Children's Hospital, as well as the owner of Primrose Newborn Care. And she has so graciously offered to join us as we talk through this time of what could be some anxiety for some of our NICU and preemie families. There's some questions and concerns, and really, we just wanted to bring her on board to help answer some of those things that are already out there and being published that maybe she can help explain to us a little bit better and how to best keep all of us and our little ones safe. Again, I know there has been a lot of concerns from our community, and we want you to know that we're here for you and we're with you. And, you know, I'm going to turn it over to Dr. Madden now to share some of what she knows.
Hi, everyone. I really appreciate having the opportunity to talk to all of you today. And I'm going to start off by saying that we are in a place with coronavirus right now that we're working with very limited information. And I've been interviewed multiple times this past week, and I'm going to speak to, first of all, what we actually do know. And then we can venture into some of the unknowns right now, but ways that we can all proceed forward, keeping ourselves safe, our babies safe, but not totally freaking out and panicking about this whole thing. Okay, so I hope that that's okay. So to start with what we do know, in terms of coronavirus and pregnancy, we do have a little bit of information that's from China, from a series of women who were pregnant, who were full term, who were diagnosed with COVID-19 shortly before delivery. And they were all delivered by C-section as a precaution because these were women that had known infection. And in this report it was published in a really big medical journal called The Lancet, all 9 babies were born full term, they were healthy, and none of them tested positive for coronavirus. So that's very reassuring information that we do have in terms of what happens if I get coronavirus right when I'm pregnant and then deliver. So that's great. The second thing that we do know is we have some limited information. Again, it's from China because they're the first country that's had this large outbreak. And they've published some information on 3 newborn babies whose moms did not have COVID-19 at the time of delivery, or they weren't recognized or known. So these babies were delivered, and they all developed the virus within the first 28 days of life, so the newborn or neonatal period. And we do know that in these cases, there was one baby who was somewhere about a day and a half old or so, who tested positive in the setting of that the mom was then known to have coronavirus, and the baby was fine. EP was followed, had absolutely no symptoms, and did totally okay. The second newborn that we do know about from China was diagnosed on the 5th day of life. It was also a full-term baby, and he or she did have a fever, but outside of that had no other symptoms and went on to do well, as far as we know. And the third baby was a little bit more concerning. It was a 17-day-old full-term baby who had been healthy, who I know the mom developed the virus in the postpartum period. And also, I think there was another caregiver or family member. The baby did get sick. The baby had presented to the hospital or to the doctor's office with fever, some breathing problems, vomiting, and I think it was lethargy, which are really common symptoms that we'd see in any newborn baby who was being affected by a respiratory viral illness. So that's what we do know. What else do we know before we venture into the unknowns? I've gotten tons of questions about what do I do if I'm breastfeeding or if I'm pumping and providing breast milk for my baby and I get diagnosed with it, or I have a concern that I've been exposed and very well might have it, but we're in that phase of time where you're not quite sure if you have it or don't have it. We're fortunate at this point. The Centers for Disease Control has put out some guidelines. They're actually up on the website. I think they're a couple weeks old, but the intention is that they'll keep them updated pretty regularly. At this point, they recommend that moms do continue to provide breast milk. I agree with that recommendation because anytime that moms provide breast milk, especially in the setting of getting a viral infection, in most cases, the breast milk's helpful because the antibodies that the mom produces against the virus will pass through the breast milk and they will protect the baby from getting it or getting too sick with it. So at this point, I think that that is a good idea. Again, we're working with limited information, but it's very reasonable precautions. They say if you have COVID-19 and you're breastfeeding, to please make sure that you wash your hands, have good hand hygiene before you touch your baby. To make sure in these cases, moms should probably wear a mask when they're feeding. And then also if you're pumping breast milk or, partially feeding, but providing pump milk, be super careful about just cleaning your pump parts and keeping everything clean, washing your hands, washing the pump parts before, washing the pump parts after, cleaning your hands. You should probably have somebody help you do that because that is a lot of work to be able to continue to do that. And then the last thing they recommend on the CDC website is to consider having somebody else feed the pumped milk to baby if you can. And these precautions pretty much hold through whether you're breastfeeding at the breast, whether you're pumping milk and feeding it by bottle, whether you're formula feeding, you're still going to be washing your hands, wearing a mask, carrying your baby, and being really careful. So that's the third piece that we know. I'm going to back up for 1 second. We also, in China, they did test breast milk, umbilical cord blood, amniotic fluid from moms who do have COVID-19. And as of to date, none of those samples have shown any evidence of the virus in them, in the body fluids and breast milk. So I feel like I just talked a ton. So I wanted to see right now if anybody has any questions. I'm going to do my best to answer honestly. So if I know an answer, I'm going to tell you. And if I don't know an answer, I'm going to tell you that I don't know, but I can do my best to try to find out.
There we go, better. While we are waiting for some people to ask some questions, Dr. Madden, what has been the biggest concern when you're being interviewed? Has it been from expecting parents or new moms?
It's been both.
Yeah.
It's been like 50-50 right now. So things people are asking for expecting parents, with the knowledge right now that we are just starting to get into the thick of it in the US. And again, there is no specific recommendation right now from the obstetric world because this is so new. I would take precautions. I think if you're, especially towards the end of your pregnancy, we do know that there is an increased risk of preterm labor. I forgot to say that earlier, but the Chinese information is showing if you get it while you're pregnant, you're at a higher risk of preterm labor. That I think very reasonable things. I probably would avoid really super crowded places right now. I would avoid sick contacts to the absolute best of my ability. I'd be really careful. And the Centers for Disease Control also on their website do have a bunch of recommendations for high-risk individuals, how to prevent getting it. There's things we've all heard about. Don't go on a cruise. I don't think many pregnant women are going on cruises at the end of their pregnancy anyway, but all kinds of things like that. I would take this a little more seriously and be careful to the best of your ability.
And of course, we always want to tell our expecting moms and new moms to make sure they're checking with their, pediatrician and their OB and all of those things. But this is one of those things that the more support you can get from the community if you're working and you are working in a very crowded place, maybe asking your doctor what their opinion is so they can help you potentially not not be in that crowded place, especially towards the end of your pregnancy. Is that something that you would say is fair or to recommend?
Absolutely. I mean, at the end of your pregnancy, you're seeing your OB or midwife so often. So this has to be a continued conversation. And what you're being told today or this week, 2 weeks ago, as we have more cases in the US, the information and recommendations might be totally different. Please rely on medical professionals and valid, reputable websites for your information, please.
Yeah.
For sure.
Yeah. We've got a couple of questions, so I'm going to start reading them to you, Dr. Madden, and you can answer. So, excuse me. One of the questions we have is from Emma, and she wants to know, what about bringing visitors up to the NICU? Again, you'd have to check with your own current NICU, Emma, but, I would ask you, Dr. Madden, what is your opinion?
So, first of all, the visiting regulations vary according to NICU to NICU. So a lot, especially during cold and flu season, because we know that premature babies are at risk of several other viral illnesses, not just flu, but any preemie parent knows about RSV, which is the common cold virus in us, but preemies can get extraordinarily sick with pneumonia and lower respiratory tract symptoms. So because of that, there's usually guidelines set in place during cold and flu season that visitors need to be 16 and over. Some, I think it's 12 or over. And also to make sure that nobody comes into the NICU to visit that's had a fever, a cough, or any recent symptoms. Again, at this point, for the protection of your baby, I would strongly recommend limiting visitors to the best of your ability over the next couple months till we have more information. The problem with COVID-19 is there is this incubation period where people get the virus, they feel okay, and then can get sick with it rather quickly. But I think we just have to take the precautions from cold and flu season for NICU visitors and really just expand those on with probably a little bit more care and concern, and really parents need to take ownership of this and be able to tell people, no, I'm sorry, you can't come visit right now.
Yeah, and I think that's one of the things we get a lot of questions about with either new NICU moms or moms that are bringing NICU babies home. How do they explain to some family members that may not understand, the baby's sensitivity to viruses and all of those things? And we do have, something on our website that you can actually print. It's like after discharge, you can send out to your family members, but feel confident in your decisions as a mom or a dad or primary caregiver of these babies to say no. Don't worry about feeling bad, and especially in a situation like this. We're going to jump on to another question, Dr. Madden. What about a pregnant healthcare worker? Are there any restrictions for someone who is in early third trimester and a nurse? Everyone so far is just saying hand washing.
That's the party line right now. So I unfortunately can't speak to that. I wish I could tell you for sure, but right now those are the current recommendations in the United States. That being said, I'm not sure. I mean, I've been working in hospitals, I worked during the swine flu. So I was back in 2009, I was in my third trimester. And that one wasn't quite as worrisome as this, but there also was information that it could affect pregnant women really badly. So at that point, it was just taking the utmost precautions with washing hands, hand sanitizing, using masks. I try my best to limit my walking around the hospital. So, I wouldn't go out into the busy open atrium, making sure to be really careful about changing into scrubs when you get to work, and then taking those dirty scrubs off, changing out of them when you get home, showering really well when you get home. It's things that probably aren't a bad idea to do anyway, but just being really more cognizant of that. I will definitely provide more info to Pam to disseminate on Project Preemie if any new recommendations come out in regards to this.
Awesome. Thank you. Kind of along the lines of bringing visitors into the NICU, what can current parents of NICU babies do when they're, coming to and from the hospital to help keep themselves safe, when they leave the hospital? So same thing, masks and hand washing. Like, what do you recommend there?
Yeah, it's exactly the same thing. Exactly. Okay. Yeah.
Okay. So we have a lot of NICU graduate parents who are watching right now, and Heather's asking about older micro preemies. She's got a 4-year-old who still gets knocked out by colds pretty bad, and they're very well versed in staying away from crowds, sanitizing, hand washing, etc. What is your thoughts on school for somebody this age?
Yes. So this is very controversial. I'm in several physician-only groups where there's been numerous discussions about this going on. Like, what do we do for our older pediatric population who maybe has some type of a risk factor, i.e. they're a former preemie who had BPD, or they have asthma or diabetes, or some health issue that doesn't necessarily make them the normal, typical preschooler or school-age child. At this point, the information that we do have, again, it's from China, is that kids, even in these higher risk populations, they personally are not, it doesn't appear that they are coming down and getting extraordinarily ill from the virus. Babies are one thing, that's an immature immune system, prematurity, those babies are immunosuppressed. So that's different. But as kids get older, it seems like this COVID-19 is not affecting them with major symptoms and illnesses. The real problem in that population is that the kids can pick it up really easily, have a little bit of a cold, even no symptoms at all, but then easily transmit or pass it on to older family members, especially the elderly. So I don't know if that really answered your question necessarily or not. People have asked, what am I doing about my own kids in school right now? I do have a daughter who has asthma. I'm continuing to follow the recommendations of my specific school and school district right now. And again, trying to trust that the correct decisions are made. So I'm not pulling them yet. That being said, I am going to be really conscious of us avoiding large crowds and social activities.
Thank you. I think we're doing the same thing here, and you hear every day that one school may close and another's not, and you're just kind of waiting for the information. I think the biggest point to know for everybody is that it's like you mentioned, it's changing. It's changing every hour, it's changing every day, and just to try to stay as informed as possible. Yeah. What about everyday life, like grocery shopping? And, one of the things we see in this community is, we have moms with immunocompromised children who actually need the hand, well, everyone needs a hand sanitizer, but the masks and the latex gloves and things of that nature. Like, if you don't present any symptoms and your children aren't presenting any symptoms, what should you be buying more of, or less should be stocking up? That's a question we're getting a lot too.
Pam, I have no idea. I have no idea right now. The information that you get is like, it's okay, like, don't worry about it.
Right.
Go to the store, just wash your hands and be careful. To what we've seen on social media, this, okay, my God, we need toilet paper for
for 6 weeks. I know.
Washing hands with soap and water is just as good as hand sanitizer. So that's something that is interesting to me, that there's this like hoarding of it, because you can wash your hands. But in terms of those questions, I can't answer them. I think everybody has to use their own judgment based on the current information. But I would err again on the side of more being cautious than not. I signed up for Instacart. I'm having my groceries delivered.
Yeah.
Not tons, I'm not stocking up for months, but yeah.
Well, I saw Uber just put out a really great email just about their drivers and the precautions they're taking. And they also have Uber Eats. There's an option now where you can leave your food outside, and so that you don't have contact with the driver. So I think everybody's taking the right steps from a business standpoint of what they can do best without creating crazy panic. What are your thoughts on, you mentioned the incubation period. So do you think that we're going to see obviously heightened cases in the next couple of weeks and then it's going to go back down? Do you have any idea, or are we still just kind of?
We're definitely nowhere near the peak from all the information that's been shared in the medical community. You'll see these estimates, but bet is we're probably 11 to 14 days behind where Italy is as of yesterday. So those are the best estimates right now. So it is going to get worse. The question that we don't know right now is, with people starting to do social distancing, being more careful with hygiene and hand hygiene, avoiding large places, is how much we're going to be able to slow down the rate of spread. And I think that's probably from a public health standpoint, one of the most important things right now. We know it's very communicable and tons of people are going to get it, but we don't want everyone to get it all at the same time and get super sick in 2 weeks. And so that's a lot of the messages coming out about avoiding these big crowded public places. Yeah, chances are a lot of us are going to come down with it at some point, but we want to slow that down so it's not necessarily during the next week or two, so that we don't overwhelm the hospital system.
And that's what's the issue in Italy, right? Is that what's happening there? They just have no space?
Within about 72 hours over the weekend in Italy, they started hitting their peak and they ran out of ICU beds.
And this is again, this is back to the older population over 60. Is that still correct?
Definitely, yeah. I mean, there are obviously cases in younger people, but it looks like everywhere where there's been South Korea, China, Italy, Iran, we're looking at still this over 60, but the numbers for the like 70, especially 80 plus, are just really alarming. Yeah.
I got muted again. Sorry. Okay, well, I'm going to ask if anyone has any more questions to let us know. And then Dr. Madden, is there any parting things you want to say to the group? I mean, I know you've been really wonderful about sharing on your social pages, and we're trying to reshare too. So if you don't already follow Primrose Newborn Care, make sure you do. But is there anything else that you want to say to everybody before we sign off here?
Just to keep updated and to be really careful what your sources are. And if you're going to share information, which of course we're all going to do because we want to help each other out, just make sure that the source is pretty reliable first, because I'm amazed by how much bad information has been shared the last 2 weeks. Again, it's so well-intentioned. People want to help each other out. But these messages now really need to come out from medical, infectious disease experts, people like that, as opposed to just people's opinions that aren't really in the heat of it right now.
Yeah, that's great. That's great.
Yeah.
Oh, I've got a couple more. Sorry. Oh my goodness. Stephanie says she wanted to know if she does get the virus, should she wear a mask while nursing her newborn? I think she just jumped on. Can you just repeat what you had mentioned earlier?
Yeah, Stephanie, the CDC website has great recommendations for breastfeeding women who come down with COVID-19, including hand hygiene, wearing a mask, if you're pumping, to be super careful with keeping your pump and pump parts cleaned. And also, if you're pumping, to consider having a non-affected family member feed your baby. The good thing right now is we don't know of any cases of it being transmitted from mom to baby through breast milk.
One other question I was going to ask, when do you decide to get tested as anybody? Just when you feel like you have a small cold? Is that when you're supposed to get tested, and are the test kits available now?
So it totally depends what part of the US you live in. They're available still through the Ohio Department of Public Health, but they're not available as of yesterday in huge volumes. So the recommendations right now, if you've been exposed and have mild symptoms, to call your doctor's office to talk about whether or not you need tested. Do not go, because if it's something that you normally wouldn't seek treatment for, so if you normally wouldn't go to the doctor if you have a cold, then don't go. Call them, and they can help walk you through the latest, availability of testing or not. In the Seattle area, they've actually set up some drive where you can actually drive to get tested, so you don't ever have to walk into a clinic or hospital. And the last I saw, they're also starting to do that in other parts of the West Coast in California. But one thing also to bear in mind, going back to pregnant women and newborns, call them for sure. If you're worried about fever, cough, symptoms, please call your doctor. But if you are having trouble breathing, like you're short of breath and you're wheezing, or your baby's having trouble breathing, or your baby has a fever, then they have to get checked out. I feel like, I don't know if I'm answering what you asked me, Pam, or not. Sorry.
No, you are. No, I think that's good. I think it's just, it's like, when do you know? Like right now, you don't know if you've been exposed. If you know you've been exposed, you've been told basically, or but there's going to come a point in time in the next couple of weeks where we all could have been exposed. So I guess The question is just, again, just use your best judgment and, right?
Yes, I think within a couple of weeks, the ability to test like thousands and thousands of people will probably be there. So that might be a point at which there's drive-up clinics. I know in Boston, one of the hospitals had a whole separate entrance set up for people with suspected infection. So that's definitely something. I would just please call and find out the latest and greatest. It's changed the last 48 hours in the Cleveland area alone in terms of how many tests have been released.
Well, we really appreciate it. We've got a lot of people that are saying thank you for you coming on and sharing this information. And again, make sure you check out Primrose Newborn Care for Dr. Madden's most updated information. And Project Preemie, of course, will share as much as we can. And we know that some of this brings back some crazy trauma and anxiety for some of our NICU parents who experience or are experiencing isolation from cold and flu season. Again, we're with you, and please feel free to reach out if you need any additional help. And thank you very much, everyone. Have a wonderful day.
Thank you. Bye-bye.